Dr. Ghatan, if I ask you about fungus, I'm sure there are many, many types of fungus and where you can get them, and maybe even, I don't know, maybe there's even different animals of funguses, and maybe there's even different names, and people don't even know this is a fungus because somebody gave it a different name, and they think it's something totally different when it's really, in the end, just a fungus. Anyway, seems to be a confused subject out there, at least it's for me. Can you shed some light on it?
Sure. Well, people refer to fungus as ringworm.
Ringworm?
Right.
Athlete's foot. Okay.
Athlete's foot. Ringworm because it has the shape of a circle oftentimes when it's, say, on the scalp or on the body. And athlete's foot because the athletes supposedly tend to get that the fungal infection on the feet more commonly. So there are other fungal or more likely yeast infections that happen on the chest, on the back. That's sort of related to some extent, but they're a little bit different, and they're dealt differently with. So fungus is very common, especially in children. African American in particular on the scalp, it's very common to get fungal infection, and they know about the ringworm. There is a patch of hair loss, there may be some redness, scaliness. If it gets secondarily infected with bacteria, there could be some oozing and crossing as well. And that kind of fungus needs to be treated with oral antifungal. A lot of times our colleagues who are not very familiar with this, they treat them with topical creams and shampoos, which are not effective because the fungus goes to the roots of the hair, and these creams and shampoos do not penetrate that far. So then the patient needs to take an oral by mouth antifungal for a period of about 4 to 8 weeks. And if it's not done properly, if it's not taken care of, then it is possible to have a hair loss permanently on the scalp. Now there is fungus on the skin, on the face. It could happen on the forearms, in the back, any part of the body. Oftentimes, what the fungus likes on the skin is a warm and moist environment, and that's why it's more commonly found on the feet and between the toes, on the sides of the feet, and in the groins, where it becomes moist and warm. So we suggest to people to keep the feet cool and dry, wear shoes and have cotton socks on, and maybe use some powder inside the shoes, powder on the feet to keep it dry and to prevent the infection. You can also powder the groins to avoid infecting the groins. It's interesting that oftentimes people have the fungus in the groin. The source is coming from the feet. It travels from the feet to the groins. Or other times they have it on the nail. Fungus of nail, also known as onychomycosis, is quite common, and it's a little bit more difficult to treat. Fortunately, we do have some medication nowadays by mouth that are much more effective and quite safe, but it has to be done under proper supervision and proper care. They do cure the problem, but it is possible for the fungus to return. There are just some people who are very prone to the fungus because of some genetic predisposition or their habits or their lifestyle or their work, where they're going to have a warm and moist environment where fungus is going to thrive.
Okay. All right. So basically, treatment, from a doctor, from a dermatologist like you, will make it go away, even though it is possible to come again, because some people just simply are very prone for it, and then you just need to treat it again, and keep the place dry and hopefully light, not moist and dark, which isn't always easy. But I guess if you know that in winter you wear boots and stuff and it is more dry, more moist, I guess you just gotta be doing more hygiene work in the evening. Make sure the shoes get dried out. Make sure you change your socks more often, and at any potential opportunity, maybe take them shoes out or stuff like that. You know what I mean? Take the feet out, so that things like that.
Right.
Now, if a fungus, rather than being the inconvenient thing it is, does it have any other health effects we should be aware of? That, like, if we don't treat it, that something else will happen?
Well, there can be what we call a secondary infection from bacteria. And, for example, when there is a fungus between the toes, it often causes a little cut on the skin. And from there, the bacteria enters and causes what we call cellulitis, which is a bacterial infection, and often happens on the legs. And that, if it's not properly taken care of, can be life-threatening. So it is a good idea to treat patients, especially if the patient is a diabetic patient. They're more prone to infections, and the immune system is a bit weaker, so they have to be more careful with this thing.
Okay. Well, again, like always, very interesting, very informative. Thanks for your straightforward answers and telling us how it is. I'm sure that people out there will like it. Thank you very much, Dr. Ghatan.